Hi, my name is Caleb Lawlor, and I will be co-presenting with my colleagues Brandon Grananetti and Matthew Jones. Our project supervisor is Dr. Adam Bignucolo, and we will be presenting a retrospective chart analysis of frostbite care in northeastern Ontario to guide emergency department quality improvement. In terms of our affiliations, we have no relationships with for-profit or not-for-profit organizations. Caleb Lawlor, Brandon Grananetti, and Matthew Jones are all students at Nossum University. Dr. Adam Bignucolo is a Nossum University faculty member and an employee of Health Sciences North, serving as the Emergency Department Quality Improvement Lead. This project has received financial support from Health Sciences North in the form of an Emergency Medicine Quality Improvement Research Grant. There is a lack of literature in northeastern Ontario that quantifies the outcomes of frostbite injuries. Modernized protocols, such as those suggested by Poole et al. 2021 for the emergency treatment of frostbite, have been shown to decrease amputation rates and improve outcomes. The aim of this research was to establish the groundwork for a Plan Do Study Act project looking at improving frostbite care in northeastern Ontario. Our goals were to identify the demographic characteristics of the populations at risk of frostbite injury and to understand the diagnosis, treatment, and outcomes of frostbite patients cared for at Health Sciences North.
The study design featured a single-center retrospective cohort study in Sudbury, Ontario, Canada. All charts of patients who presented to HSN from 2020 to 2023 and were assigned an ICD-10 code of frostbite were reviewed. 91 charts were identified. 63 patients met inclusion criteria, while 28 patients were excluded as there was no documented frostbite on the chart. The data was compiled using Microsoft Excel and statistical analysis was performed. Of the selected patients with frostbite, 51 of which were male. The distribution of severity included 10 patients with grade 1 frostbite, 14 patients with grade 2, 10 patients with grade 3, and 29 patients did not receive a grade. There were no grade 4 injuries reported. There were 13 patients requiring hospitalization and 9 patients requiring amputation. Of the patients requiring amputation, 3 did not have their injury graded, 1 patient was graded a 2, and 5 patients had grade 3 injuries. There were 22 patients identified as homeless who developed frostbite, 20 of whom were male. Of the 22 homeless patients, 7 required amputations.
The population that HSN serves is at high risk for frostbite injury due to geographic location and high incidence of homelessness. A substantial number of homeless patients required amputations compared to non-homeless patients, suggesting that frostbite outcomes may be viewed as an area of inequity. Many patients had no frostbite grading, which impacted their treatment and created ambiguity in outcomes. Further, 25% of patients with grade 2 or 3 injuries required amputations. Poole et al. 2021 showed 0% amputation rates in these groups when given appropriate treatment. This justifies our future goals in the development of standardized education in frostbite grading and the implementation of a treatment protocol as a next step in this PDSA framework. We would like to acknowledge Health Sciences North Research Institute's Jenna Nichols and Danielle Waltenbury for their logistical support, and we would like to thank you for listening to our presentation.